of the week, the updated COVID-19 vaccine should be available at pharmacies all over the country.
Yeah, but only 1 in 5 Americans got the last booster. 11 Alive's Jonathan Martin spoke with the new CDC Director, Dr. Cohen, about how her agency is working to get more Americans vaccinated this time.
I think these vaccines are safe, they're effective.
In her first 2 months as director of the CDC, Dr. Cohen has been focused on the new COVID vaccine rollout. This week, the CDC recommended updated booster shots for Americans 6 months and older.
And the reason we're recommending it for all ages is there really no age group that isn't impacted still by COVID. But I will say those over 65, that is really still where we are seeing most of our hospitalizations and sadly most of our deaths.
Still, many have COVID fatigue, and while the number of cases is rising, the overall risk is still mild. Less than 17% of Americans got the last updated booster. It's why Cohen met with stakeholders Thursday about getting the right message out to communities.
Folks who have had COVID before or been vaccinated before, good, you have some protection, but that protection decreases over time. This is your opportunity to sort of bring it back up to that highest level of protection that you can.
Dr. Cohen recognizes the need to build trust when it comes to the vaccine and overall public health.
The way I know to do that is to be as transparent as I possibly can, to tell folks what I know, when I know it, and also what I don't know. And that's why this week I can tell you what I know about the COVID virus and that this new vaccine is mapped to the current version of the virus, but that virus also could change. And I'll come back and I'll let you know if anything does change in that way.
The Moderna and Pfizer vaccine should be available as soon as this weekend in pharmacies and some doctors' offices, mainly through Medicare or Medicaid and private insurance. Jonathan Martin, 11 Alive News.
And here's some information for you, very important information for the millions of uninsured Americans. The Department of Health and Human Services launched its Bridge Access program. It provides continued coverage for adults who would have otherwise lost access to affordable COVID-19 vaccines. Now, this program is temporary and it will end in December of 2024. There is a long-term proposal, but that has not been approved yet.